Welcome back to Las Vegas. Now, pediatricians are usually busy this time of year with back-to-school visits, but concerns of the coronavirus are keeping some away. Should the pandemic cause you to push back that appointment? JC spoke with a Southwest medical doctor for some advice.
Dr. Henderson, thank you so much for joining us today. How are you?
I'm doing well. Thank you very much for inviting me.
Okay, so we are still in the middle of a pandemic, and there are many parents out there that are concerned about taking their children to go see their doctor or for their routine visits. What are your thoughts on this?
It's very important for parents to know that they do need to bring their child in for their regular well checkups. It's not a good idea to be delaying care. Sometimes small, minor problems may not be noticed initially, and if you keep delaying, they become bigger problems. So it is important to have those well checkups to ensure that their child is staying healthy and is meeting the correct milestones.
So I'm going to ask you the question. I think a lot of businesses are presented with this question. Is it safe to come in and see my doctor?
It is safe. Now, of course, if you have any questions, you should call ahead to the clinic or your pediatrician. But even before COVID, we had a lot of infection control procedures in place, including standard rooming where we disinfect and clean the rooms each time someone comes in. We also were sort of ahead of the game with social distancing in pediatrics. We've always had well and sick separate rooms, waiting areas, even for these kids. So we've now enhanced those features. We do screenings at the front door, temperature checks, provide masks, provide access to sanitizers. All of these things we encourage to maximize safety for all of our patients.
Yeah, you guys really are doing amazing things. And I know there's some parents out there watching right now who know they have to get vaccines for their kids, but they're probably saying, what, I can put it off a month or I can put it off 2 months. What's the danger with putting off getting the vaccines?
It's really important to note that vaccines don't work instantaneously. It takes time for the body to develop those antibodies to protect your child. The last thing you want to do is hear about an outbreak of something such as measles and then say, oh, I better immunize my child, because there is a lag period for that child to develop those appropriate antibodies. If you immunize on time, all the time as recommended, your child will always be protected, and you don't have to worry about those gaps in care. So we definitely encourage, come in on time, follow the recommendations from the American Academy of Pediatrics, and get your child immunized.
So Dr. Henderson, why is it so important to get vaccinated?
Vaccines are one of the single most ways to protect our children from preventable infections. Vaccines have saved millions of lives and also improved the quality of life in all of our children. It's so important to do it on time because, again, this is one of the single best ways we can do to help our kids not get so many of these very serious and devastating childhood illnesses.
Dr. Henderson, thank you so much for your time. And just our little conversation here just showed that it is safe to go see your doctor. In Southwest Medical, you guys are covering so many different layers. It's fantastic to see this in the community. Thank you so much for joining us.
Thank you very much.
All right, thank you, JC. I'll actually be hosting a Facebook Live today with Southwest Medical and Associates at 4:30 p.m. on the 8 News Now Facebook page. So for more information, give them a call at 702-877-5199 or just visit smalv.com. Mercedes.